Over 700,000 Americans are living with a brain tumor right now, and about 30% are discovered accidentally during routine checkups when people had no idea anything was wrong. The National Brain Tumor Society reports that nearly 90,000 people will receive a brain tumor diagnosis this year alone. Many could have been caught earlier if people had recognized the warning signs. I'm Dr. Daniel Lee, and I've spent over a decade as a practicing physician, helping patients understand their health concerns and take proactive steps toward better outcomes. In the next 20 minutes, I'll walk you through 8 specific early warning signs that could make the difference between catching a brain tumor early, when treatment is most effective, and discovering it when options become limited. First, let's start by understanding what we're dealing with. The human brain is your body's command center, controlling everything from thoughts and memories to movements and senses. Sometimes abnormal cells begin growing and multiplying uncontrollably. These masses are what we call brain tumors. Think of your brain as a highly organized city with specialized neighborhoods. The frontal lobe handles decision-making and personality. The temporal lobe processes memories and language. The occipital lobe manages vision, and the cerebellum coordinates balance and movement. When abnormal cells multiply uncontrollably in any of these areas, they form what we call a neoplasm or tumor. Brain tumors come in 2 main categories. Primary tumors originate in the brain itself, developing from brain cells, membranes, nerves, or glands. Metastatic tumors start as cancer elsewhere in your body and spread to the brain. Medical science has identified over 120 different types of brain tumors. Here's what many don't realize. Not all brain tumors are cancerous. All brain cancers are tumors, but not all brain tumors are cancer. Some tumors are benign, growing slowly and staying in one place without spreading. While benign tumors aren't cancerous, they can still cause serious problems by putting pressure on important brain structures. Malignant tumors are more dangerous because they grow rapidly and invade nearby healthy brain tissue, making them potentially life-threatening if not caught early. Before we discuss the 8 warning signs, let me share important context about risk factors. While brain tumors can affect anyone at any age, certain factors increase risk. Age itself is significant, with some types becoming more common as we get older. Family history of brain tumors may slightly elevate risk. Previous radiation exposure to the head can increase risk years or decades later. Conditions weakening your immune system may also play a role. Understanding these factors isn't about causing worry. It's about being informed so you can be vigilant about health changes. Sign number 1. Persistent headaches following a specific pattern. We all get headaches occasionally, but brain tumor headaches are different. These headaches typically intensify during early morning hours or when lying down because cerebrospinal fluid accumulates while you're sleeping, increasing pressure inside your skull. What makes these concerning is their progressive nature and resistance to typical pain medications. Unlike migraines that might improve with rest in a dark room or pain relievers, tumor-related headaches persist regardless of what you do. The pain follows what I call a pressure cooker effect, building gradually and becoming most severe during rest periods. Many patients describe projectile vomiting without preceding nausea, which distinguishes these from regular migraines. The pain might worsen with activities that temporarily increase pressure, coughing, sneezing, bending over, or physical exertion. Location matters too. While pain can be generalized, it often concentrates in specific areas corresponding to the tumor's location. These headaches may wake you from sleep, which is highly unusual. If you're experiencing these headaches, keep a detailed diary noting time of day, severity on a scale of 1 to 10, what makes them better or worse, and accompanying symptoms. Bring this to your doctor. Sign number 2. Speech and language difficulties appearing suddenly. Speech and language problems, called dysphagia or aphasia, manifest in complex ways when caused by brain tumors. The brain's language centers are primarily in the left hemisphere, responsible for both producing speech and understanding language. When tumors affect these regions or connecting pathways, they create distinct patterns of language impairment. Tumors near the frontal lobe can result in halting, effortful speech. You understand language perfectly, but struggle to produce it fluently. Speech comes out in short, grammatically incorrect sentences that sound telegraphic. Tumors in the temporal lobe might produce the opposite, fluent but meaningless speech where you talk in long, grammatically correct sentences that lack coherent content. Some tumors affect pathways connecting different language areas, resulting in difficulty repeating phrases while spontaneous speech remains normal. Large tumors affecting multiple language areas cause comprehensive problems with both speaking and understanding. Subtle changes often precede obvious symptoms. You might initially struggle with complex vocabulary or have difficulty following rapid conversations before developing more pronounced speech problems. These changes typically progress over time without intervention. Document specific examples of what's happening and when you first notice changes. Sign number 3, seizures, especially if you've never had one before. Brain. Tumor-related seizures often begin subtly with focal seizures affecting only specific body parts or senses. These serve as early warning signs before progressing to more severe episodes. Focal aware seizures allow you to maintain consciousness while experiencing involuntary muscle movements, unusual sensory experiences, or emotional changes. Focal impaired awareness seizures alter consciousness and might cause repetitive movements called automatisms, lip smacking, hand wringing, or picking at clothes. The seizure type often tells us where the tumor is located. Temporal lobe tumors frequently cause complex partial seizures with strange sensory experiences or déjà vu sensations. Frontal lobe tumors might trigger seizures affecting motor function or speech. Occipital lobe tumors can cause seizures with visual disturbances like flashing lights or temporary blindness. Adult-onset seizures, particularly after age 40, require immediate medical evaluation. Unlike genetic epilepsy appearing in childhood or early adulthood, new seizures in adults may indicate underlying structural problems like tumors. If you experience a first-time seizure, especially over 40, treat it as a medical emergency. Sign number 4. Vision problems your optometrist can't explain. Vision disturbances from brain tumors range from subtle to severe depending on tumor location and size. Visual information starts at your eyes, travels through optic nerves, crosses at the optic chiasm, and continues to the occipital lobe where visual processing occurs. Different tumor locations cause specific vision problems. Tumors near the pituitary gland often cause bitemporal hemianopsia, losing vision in outer fields of both eyes, creating tunnel vision. Tumors affecting the occipital lobe might cause homonymous hemianopsia, where corresponding visual fields in both eyes are affected, losing the left or right side of vision in both eyes simultaneously. Some experience papilledema, optic nerve swelling from increased skull pressure. Other disturbances include nystagmus, involuntary rhythmic eye movements, or oscillopsia, objects appearing to bounce or jump. Color perception might change with decreased ability to distinguish between colors or complete color blindness in portions of the visual field. These changes often progress so gradually they're easy to overlook or attribute to normal aging. Any persistent visual symptoms, especially those not improving with rest or standard vision corrections, warrant immediate attention. Track exactly what's changing and when you first noticed it. Sign number 5. Personality changes making you seem like a different person. This is one of the most distressing symptoms for patients and families, often occurring before other symptoms become apparent. These changes happen when tumors affect the frontal lobe and areas regulating emotions and behavior. What makes these significant is how dramatically they depart from established personality patterns and how relatively rapidly they develop. Some experience increased irritability or sudden aggressive behavior that's completely out of character, snapping at loved ones over minor issues. Others show inappropriate emotional responses, laughing at sad news or remaining unmoved by typically joyful events. Mood swings become more frequent and intense, changing rapidly without clear triggers. Changes might manifest as increased apathy or profound loss of interest in previously enjoyed activities. Family members often notice these changes first, reporting their loved one just isn't themselves anymore. Some become unusually impulsive, making uncharacteristic decisions about money, relationships, or important life matters. Social behavior might change significantly. Previously outgoing people become withdrawn, or typically quiet people become unusually talkative and uninhibited, saying inappropriate things. These changes persist and worsen over time, unlike temporary mood changes from stress or lack of sleep. If family or friends tell you they've noticed these changes, take their observations seriously. Sign number 6. Cognitive and memory problems progressing faster than normal aging. Cognitive changes from brain tumors begin subtly but progress more rapidly than normal aging. The frontal and temporal lobes play crucial roles in memory formation and cognitive processing. When tumors develop in these regions, they disrupt mental processes noticeably. While long-term memories typically remain intact, short-term memory becomes particularly affected, making it difficult to retain new information. You might forget what someone told you 5 minutes ago or why you walked into a room. Tasks requiring planning, decision-making, and problem-solving become increasingly challenging. You might struggle following a movie plot or lose track of conversations even when actively trying to pay attention. Daily life impact becomes substantial. Managing finances becomes challenging with difficulty tracking expenses or making calculations. Following recipes becomes harder. Assembling furniture or completing work projects takes much longer. Multitasking becomes particularly difficult, and staying organized requires far more effort. Here's how you tell this isn't normal aging. The relatively rapid onset and progression. Age-related cognitive decline occurs gradually over years. Tumor-related changes typically develop over weeks to months. Symptoms might fluctuate day to day, but the overall trend shows a pattern of decline without intervention. Keep a journal of cognitive changes, noting specific examples and dates. Sign number 7. Numbness and weakness, following specific patterns. Numbness and weakness from brain tumors have distinct patterns, setting them apart from common causes like poor circulation or pinched nerves. These symptoms typically affect specific body parts, most often on one side, and can develop gradually or suddenly. When tumors develop near areas controlling movement and sensation, they interfere with normal nerve signaling. This might begin as mild tingling or pins and needles sensation in specific body parts. Over time, these progress to actual numbness, where you lose feeling, or weakness, where you can't move the affected part as strongly. Simple tasks like buttoning shirts, typing, or holding coffee become increasingly difficult. The progression follows a predictable pattern. Occasional intermittent tingling becomes persistent numbness. Mild weakness progresses to more significant strength loss. Some experience facial drooping on one side or difficulty maintaining grip strength. These symptoms might fluctuate throughout the day but generally worsen over time. Here's crucial brain anatomy. Different regions control different body parts, with a crossover effect. The left side of your brain controls the right side of your body, and vice versa. So a tumor affecting the left brain might cause symptoms on the right body side. Note which side is affected and track progression over time. Sign number 8. Balance and coordination problems disrupting daily activities. Balance and coordination problems significantly impact quality of life when caused by brain tumors. These symptoms often indicate a tumor affecting the cerebellum, the part at the back of your skull responsible for coordinating movement and maintaining balance. Changes might appear gradually or suddenly. Walking becomes increasingly challenging with tendency to drift to one side or experience unexpected falls on flat, clear surfaces. You might need to hold on to walls or furniture for support when you never needed it before. Fine motor tasks like writing, using utensils, or buttoning clothes become difficult. Some patients describe feeling drunk, even when sober, experiencing constant unsteadiness or vertigo, making the world feel like it's spinning. Coordination problems extend beyond basic movements. You might have difficulty judging distances accurately, like reaching for a glass and missing it. Tasks requiring hand-eye coordination become particularly challenging. Even sitting still might require more concentration with constant need to adjust position to maintain balance. These symptoms typically don't improve with rest and often worsen over time. Unlike occasional clumsiness or temporary balance issues from inner ear problems that usually resolve, tumor-related coordination problems persist and progressively affect more daily life aspects. Document when symptoms occur and how they impact everyday activities. Let me share a real-life example. I had a patient, Margaret, a 68-year-old retired teacher who came to see me because her daughter insisted something was wrong. Margaret had persistent morning headaches for about 2 months, but dismissed them as stress. Then her daughter noticed Margaret having trouble finding words during weekly phone calls, completely unlike her mother, who'd been an English teacher. Margaret also felt unusually irritable and lost interest in her book club she'd attended faithfully for 15 years. When her daughter visited and saw Margaret stumble several times and struggle setting the table, she knew these symptoms together were concerning. Margaret's evaluation revealed a meningioma, a typically slow-growing brain tumor. Because it was caught relatively early, Margaret underwent successful treatment and made an excellent recovery. She's back to her book club and doing well. This illustrates something crucial. One symptom alone might be easy to dismiss, but when you notice several warning signs appearing together or persisting over time, that's when you need to take action. So when should you see a doctor? If you have a single symptom persisting for several weeks without improvement, that warrants evaluation. Multiple symptoms from our list in combination require prompt medical attention. Pay attention to symptoms progressively worsening over time. Certain situations constitute true medical emergencies, experiencing a first-time seizure, sudden loss of consciousness, the worst headache of your life coming on suddenly, or sudden vision loss. These require calling 911 or getting to an emergency room immediately. Let me walk you through what typically happens when you see a doctor about these concerns. Your doctor will start with a thorough neurological examination, testing reflexes, coordination, sensation, and cognitive function. If there's concern based on that examination and your symptoms, they'll likely order imaging tests. An MRI is usually preferred because it provides detailed brain tissue images and can detect even small tumors. A CT scan might be used in certain situations, particularly emergencies. If imaging reveals a suspicious mass, a biopsy might be necessary to determine exactly what type of tumor it is, which guides treatment decisions. Don't hesitate to ask questions about what tests are being ordered and why, what the doctor is looking for, the timeline for results, and what treatment options might be available if a tumor is found. Let me address some common myths. Myth: only older people get brain tumors. While certain types become more common with age, brain tumors can affect people at any age. Myth: brain tumors are always fatal. Many brain tumors are highly treatable, especially when caught early, and survival rates have improved significantly. Myth: cell phones cause brain tumors. Despite extensive research, there's no proven causal link. Myth: if you don't have headaches, you can't have a brain tumor. Not everyone with a brain tumor experiences headaches, which is why it's important to be aware of all these warning signs. Here's something that should give you hope. We're living in an incredible time for brain tumor treatment. Surgical techniques have become more precise with technologies like image-guided surgery. Targeted radiation therapies can now focus treatment on tumor cells while minimizing damage to healthy tissue. New medications and immunotherapies are showing promising results. 5-year survival rates for many brain tumor types have improved significantly compared to 10 or 15 years ago. Early detection remains one of the most important factors in improving outcomes. While we can't prevent all brain tumors, supporting overall brain health is valuable. Stay on top of regular health screenings and checkups. Maintain a healthy lifestyle with a balanced diet rich in fruits, vegetables, and omega-3 fatty acids. Regular exercise improves blood flow to the brain and supports cognitive function. Keep your mind active with mentally stimulating activities. Manage stress through meditation, deep breathing, or activities you enjoy. Most importantly, stay informed about your body and be proactive about your health. These 8 warning signs aren't meant to cause fear. They're meant to empower you with knowledge. Experiencing one or even several of these symptoms doesn't automatically mean you have a brain tumor. Many other conditions can cause similar symptoms. But what's important is not ignoring persistent or progressive symptoms. Early detection truly saves lives. If you're experiencing any of these warning signs persistently or in combination, don't wait. Make an appointment with your healthcare provider. Be specific about your symptoms, when they started, and how they've progressed. Advocate for yourself and ask for the tests and evaluations you need. Now, if you found this video helpful, please hit that like button, and if you have questions, drop a comment below. I'm Dr. Daniel Lee, and I'll see you in the next video.